Welcome to the El Paso Stress Management Counseling Center, where we apply behavioral therapy to help you cope and manage your stress and anxiety. My name is Alejandra Beltran, and today I will explain the approach to counseling that I can offer you. Behavioral therapy is a term that describes a broad range of techniques used to change maladaptive behaviors. The goal is to reinforce desirable behaviors and eliminate unwanted ones. Behavioral therapy suggests that since old learning led to the development of a problem, then new learning can fix it. Behavioral therapy is a problem-focused and action-oriented approach. For this reason, it can be useful for addressing specific psychological concerns such as anger management and stress management. If you find this information interesting and you'd like to learn more, let me begin by explaining your first session. We will begin by conducting a functional assessment to gather information about the problem you are experiencing, to measure the dimensions of the problem behavior, and to analyze the consequences of the problem. My goal in your session is to be a problem solver. We are here to focus on the what, how, and where. After your assessment, we will create goals together for your treatment plan. Our goal is to create new conditions for learning. Therefore, we will create goals that are clear, concrete, and understood, but most importantly, goals that you agree and feel motivated to achieve. After the goals have been established, I will discuss with you strategies that we can do to help meet your goals. These strategies are evidence-based practices that you will learn in your sessions and you can continue to practice in your daily life. Lastly, we will conduct evaluations as we continue to work together and to measure your success for the treatment plan. I will always be here to encourage you along the way, and if needed, we can always adjust treatment to better fit your mental health goals. Stress management is a skill that should be taught and learned at an early age. In a recent study, anxiety disorders in youth are the most common mental health disorders and typically have their onset in childhood or early adolescence. Untreated anxiety disorders in youth are associated with poor functioning in several areas of life, as well as causing significant risks for functional impairment later on in life. Stress, anxiety, and depression prevent college students from concentrating and maximizing learning for the full development of students' talent. Due to the increase in its occurrence, stress has become an important topic in the academic environment and raised the need for implementation on interventions for its adequate management, since anxiety and depression disorders are closely related to this discussion. Stress management is the ability to maintain and control oneself when the situation, people, and events make excessive demands. Thus, changes in the behavior of a college student must be verified and monitored in order to promote intervention, to protect the physical and mental health, general well-being, and the conditions for a good adaptation to changes in life, enhancing safer steps and confidence in the student's professional and personal lives. As your counselor, I expect you, the client, to assume an active role by engaging in specific actions to deal with the issue we are addressing. Rather than simply talking about it, you will be required to do something to bring about change. We will be creating a new conditioning for learning. Therefore, we will try different techniques to change your maladaptive behaviors. One of the techniques I like to use is role-playing new behaviors, where we practice a desired behavior in the safety and privacy of your session to better prepare you for everyday life. As a behavior counselor, I like to challenge you today to consider these questions. What are some specific things you might be doing that contribute to the state that you're in? What would you most like to change? As you are considering this approach, I leave you with this. A key strength of behavior therapy is its precision in specifying goals, targeting behaviors, and procedures to improve your quality of life. Together, we will be so specific about your treatment that we will translate your unclear goals into concrete action plans, bettering every single day of your life. Thank you. When you're ready, give us a call. We'll be ready.